Hi, my name is Godinich. I hold an MD and an MPH from Texas Tech Health Sciences Center Paul L. Foster School of Medicine and the UT Health School of Public Health. Before entering medical school, I also completed a Master of Business Administration and a Master of Healthcare Administration from the University of Houston, Clear Lake. My undergraduate degree is in biology with a psychology minor from the University of Charleston in West Virginia, where I played Division I volleyball. Clinically, I am completing a preliminary year in internal medicine and am currently a radiation oncology resident at UT Southwestern Medical Center in Dallas. That combination of medicine, public health, and business has really shaped how I approach research. I think about problems from multiple angles simultaneously: the clinical side, the population health side, and the system side. My research sits in a few intersections. The biggest one is cancer health equity. A lot of my work looks at how displaced populations, migrants, or underserved communities along the US-Mexico border experience cancer inequities and gaps in care. I have also done significant work in radiation oncology, particularly applying artificial intelligence and machine learning to predict pain outcomes and optimize treatment for the head and neck cancer patients. Beyond that, I'm very passionate about medical education research. I have helped develop and evaluate online electives on cancer immunotherapy, border health, and other outreach for medical students. So my research spans clinical oncology, public health, and how we train the next generation of physicians. I have published over 20 peer-reviewed journal articles across oncology, public health, dermatology, and medical education. Some of the work I am most proud of includes a systematic review on cancer pain management using artificial intelligence and machine learning, published in the Journal of Pain and Symptom Management. Additionally, I completed a scoping review on cancer inequities faced by displaced and migrant populations along the border, published in the International Journal of Public Health. I also have several papers on medical education innovation through journals like Medical Science Educator and JMIR Medical Education. I have presented at national conferences, including ASTRO, ASCO, SITC, and the International Medical Science Educator Conference. And I have had research featured in international media as well. I have received competitive funding and awards, including the ASTRO BCRF Radiation Oncology Visiting Away Rotation Scholarship and the MD Anderson Visiting Away Rotation Scholarship. Each of these experiences has taught me how to build a project from a question all the way through to dissemination. And that full cycle experience is exactly what I bring into mentorship. This is something I genuinely care about. Through the JAMP program, I have mentored over 100 pre-medical students, and that cohort achieved a greater than 90% medical school acceptance rate. Through MCAT tutoring, students improved their scores by an average of 10 points, which is a meaningful difference for medical school competitiveness. In terms of research specifically, students I have worked with have been involved in published abstracts presented at AIUM, SAAOG, and the Global Adolescent and Young Adult Cancer Congress. I have seen mentees go from having no research experience to standing in front of an audience at a national conference presenting work they contributed to. That progression is what really drives me. The goal is always that the student leaves the experience more capable and more confident than when they started. What I think sets me apart is that I sit at the intersection of clinical training, public health, and research. I am not just a researcher mentoring students. I am someone who is active in clinical training right now, doing the work alongside mentees in real life. I understand the pressure of balancing research with everything else a student carries. I also approach mentorship with a full cycle mindset. I do not just hand students a task and wait for output. I work with them on framing the research question, understanding the methodology, interpreting results, and preparing for dissemination through abstract submissions and presentations. Every step is intentional and educational. My background in business administration also means I think about timelines, project management, and communication in structured ways that many research mentors do not formalize. My greatest strengths are accessibility and adaptability. I make myself genuinely available to students. Research can be intimidating, especially early on, and I want students to feel like they can ask any question without judgment. I am also strong at matching the student to the right project. Not every student has the same goals. Some want a publication for their application, some want to develop a skill, some want to explore a field they are curious about. I take time to understand what a student actually needs and then build the experience around that. And because I work across multiple research areas simultaneously, I can usually find a meaningful entry point for students who come from, different backgrounds and might have different interests. I grew up wanting to go into medicine, and I did not always have clear guidance on how to build a research profile or navigate academia. I know what it feels like to figure things out without a roadmap. That experience is part of why I mentor. Research opens doors. It teaches you how to ask better questions, think critically, and communicate ideas. Those skills matter whether you go into academic medicine, private practice, public health, or even policy development. I want every student I work with to walk away with something concrete, a publication, a presentation, a skill, or at minimum, a clearer sense of where they want to go. When a student sends me a message saying they got accepted or that their abstract was selected or that they finally understand how to read a methods section, that is meaningful to me. That is the work that I do.